But we're looking at, we want to change behaviors, then that means that there's environmental factors that have to change, okay, and that there's also the internal factors that have to change. The person's desire, making people aware that they are in control of their lives and that they need to make decisions to have healthy lifestyle, as well as having the ability to manage that. And so a big emphasis on role modeling here. And so therefore the message of why you want to then involve teachers and parents in this process. And we really began to emphasize that the importance of that children don't just listen to us. In fact, we rarely listen to our parents. We copy what we see adults in our lives doing. So when we see adults who are physically active, eating balanced food, we copy that. When we see parents, adults who are smoking and drinking alcohol and, you know, living la dolce vita, then we will want to emulate those kinds of things. We looked and used as a model the proceed model of health promotion, which comes from Lawrence Green and company. They were out at UBC back in the 90s. And it's the whole idea is diagnosing your environment, diagnosing all aspects of your environment, identifying what kind of outcome do you want to have. Okay, you want to have a healthy community. So then through your diagnosis, see where the problems are, and then identify, okay, what do you want for each of these stages? What do you want to have in place? And then putting things in place and monitoring, evaluating, so that it's impact evaluation, it's outcome evaluation. We also relied on the Ottawa Charter for Health Promotion to identify some of the areas of activities that we wanted to focus on. And the important things to remember in the Ottawa Charter was to develop, and this was from 1986, and it was a world gathering. It took place in Ottawa, so they called it the Ottawa Charter for Health Promotion. What's important is that people need to develop personal skills. Okay, so therefore school curriculum for children, education programs for adults. We need to reorient health services. In First Nations and Aboriginal communities, we are notorious for getting money for projects or programs and then putting walls around our little desk or our little office or in our little cubicle and say, I do diabetes prevention, and that person over there does smoking cessation, and that person over there does alcohol prevention, and that person over there does Brighter Futures child care support. And no, we don't talk to each other. We have our own work to do, and the government has given us money and very clearly outlines that we're not to duplicate services or to share or partner with anybody. So that I will have my diabetes walk, and I'll do all my work and effort to organize it. That person over there will do the cigarette cessation, smoking cessation walk, and she will do her activities in isolation and do that alone and not tell us about it. And that person over there will do it with the alcohol, etc. Divide and conquer through funding programs. So we have to knock down the walls to that. And people have to communicate with each other and partner and work together. Doctors and nurses need to work together in clinics. The diabetes nurse needs to know who's diagnosed with diabetes so they can make first contact with them. Things like that. Building healthy public policy. Okay? No smoking is working in Canada. When we look back to the 1970s, you know, every time I get on an airplane, I remember when I sat in the back of the plane, smoked cigarettes. No problem. But then again, we also used to just walk up to the airport, present our tickets, and just keep on going and have a nice day. And now, you know, we're getting close to this. Well, the strip search is there, huh? They always pass me by, though. I never get asked. And so that's just an example of that works. But if we want to have healthy policies, no junk food in schools is catching on. It's catching on in Ontario fairly well. In First Nations communities, it's a little bit of a different story. Dog bylaws. How many folks here have worked in or been to visiting First Nations communities? We're all about the dogs. The dogs are free. They used to be free. And I remember as a kid, there used to be dogs roaming all over town. They didn't bother you. But in the 70s and 80s, people began to introduce more aggressive breeds of dogs, and people also would train them to be vicious. So dogs are pack animals. They're like wolves. They hunt. They hunt. And so it becomes a problem so that people don't walk or run or bicycle around the community because they get attacked by dogs. And I mean, we still see it in the paper from time to time when people are mauled. And so dog bylaws are examples of public policies, things you want to have in place. Creating supportive environments, places where it's conducive to have healthy eating and it's encouraged, it's supported, where there's physical activity available. Likewise, strengthening community actions. Okay, community events where there's wellness, where there's healthy lifestyle, where there's positive. That's all inside the Ottawa Charter, and we utilize these points in developing intervention activities. And after the first 3 years of the project, when we did our evaluation, what we found was that we had actually just naturally included things like the responsibility of people for their actions as individuals or as representing organizations or as programs to be responsible. Group decision making, when you involve people in dialogue and in decisions or recommendations, you empower community. So too then, when you are working with a patient, when you're working with an individual one-on-one and giving them information and teaching them and all, there's also that empowerment part that we support the learning that they're doing so that they're able to make good decisions. And sometimes, yes, we have to take people by the arm and walk them that way because, again, back to that first topic in the last presentation, multi-generational trauma has knocked people down. And so this is, you start to stand people up. But we saw that this had been a part of it. When you involve people in community decision making, they become empowered and they want more. They like it. They want it. And again, this was a community where it was kind of being practiced anyways. Living in balance and consideration for future generations were also important. Traditional concepts that we identified. And these are not exclusive Iroquoian philosophies or ways of doing. Okay, we certainly don't own these things, but these are a part of our traditional ways, and we pulled them out. We identified that we had incorporated those in what we did. In 1995, we gathered 100 people in August and began a process of developing a community vision. And by October, this was the final product. First line, one day, the community said, one day we'll all be in excellent health. There'll be no diabetes. And people will have access to healthy foods in any way, shape, and form. And people will be able to be involved in physical activities in whatever kind they need to do. And school programs and organizations will have healthy policies so that people will go from one place to the other and exist in a milieu where there's positivism around eating, around physical activity, around how we look at things. And all people accept the responsibility. Very lofty. We reviewed this with about 30 people in 2004. They tweaked a couple of words and then got into a big debate about putting a date on this thing. Because if you notice that this vision statement has no date. And at the end, there was a consensus among the community members participating in the review that we can't put a date on this. It's 7 generations thinking. And so that we say 7 generations, this is what we'll have. And we'll leave it like that. But it still tells us that today we have to be doing something. Because as soon as we stop doing anything, then we move away from the vision. Like I said earlier, the group does something and it moves ahead a little bit. And then the next generation, after we're gone, that next generation that comes in, what they're going to do is built on what we did. And it's going to move things a little bit further. That's how it goes. Tough as hell when you're working one-on-one with a patient on their limited timeline, or you're trying to teach children or parents about healthy eating, knowing that, you know, there's only that limited amount of time, you know, that a person is here on Earth. You know, we don't know the date or the amount of time, but we know that it is limited in the scope of things, so we do the best that we can. And so that's the vision statement that was developed and is maintained as the, as the important part about the project. The idea of this project was working on community participation. And so the Diabetes Prevention Project partnered with the Kahnawake Education Center, which controls the 2 large high schools on the reserve, 2 elementary schools and 1 high school on the reserve. And also, Kahnawake is one health agency, and that's what that word basically means. The one group of people that are responsible for health. And that's a combination of local organizations, the hospital, community family services, fire department as well. And so we have a 3-way partnership going on in the community around doing diabetes prevention. And then the community also has developed a partnership with universities. And right from 1994, McGill University and the Université de Montréal were the key partners, the key researchers, the senior researchers on the grant came from those 2 universities, from public health and from medicine, family medicine. And today at McGill University, they have a department or a program known as Participatory Research at McGill. And in 2002, Queen's University came on board when one of our postgraduate students in physical activity and kinesiology took an appointment there, and then had some students that did some work with us in the project. And so in the research line of things, the community has its own code of research ethics and is in a partnership with the universities, depending on what kind of research is being done and the students that are being involved with that. And so that, both have research ethics that need to be approved, and the universities respect what's done here. The whole idea, particularly around the research aspect of the project, is creating knowledge, Okay, and on the community side, we have community members and the staff are people from the community, and on the university side, researchers and students. Although there may also be Indigenous researchers and students on that side of the coin as well. That's what we're seeing in the last 2-3 years now. Okay. All of this is overseen with how we make decisions, and we just kind of fell into that natural pattern of, okay, one group does talking and dialogue and comes with an idea and then shares it with another group. And in this case here, the staff are the ones that develop the agenda of the day. What are we doing? What are the issues? We're the frontline workers. We're working in the schools, in the community with parents, et cetera. So we see what needs to be done. And we come up with ideas. And we discuss these with the researchers. Or in the Longhouse within the Mohawk Nation, we have the well keepers and the people across the fire. These are 2 of our clans. And so the staff and researchers discuss ideas and come up with ideas for these are things that we want to look at. These are things we think will work. And then our responsibility is to bring it to the community. And in this case here, it's a community advisory board or governing bodies who then will confirm the decision of what we want to do. So let's say we want to come up with, a brown bag lunch program where you get work with parents and the schools for kids to come to school with healthy lunches. We call it, and the old brown paper bag concept, right? And talking with the researchers, say yes, and we can track, the different kinds of foods and the frequency, et cetera. Yeah, we think this is a good idea, et cetera. So we'll talk about that and then bring that to a community advisory board meeting. And then they'll start asking questions. Well, did you think about this? What about, how will parents react to this? What if the kid, they'll put up the questions, and so we engage in dialogue. And it's not a case of, we don't think that's a good idea, we're not going to do it. It's a case of, let's take this idea and talk it through so that we then have a good intervention activity or we have a good piece of research that's being conducted.